hope everybody enjoyed their weekend. We had a great Memorial Day weekend. And so, as things get warmer and we get into the summer, I just want to remind folks that we can't think that things are back to normal just right away. We need to make sure that we're listening to the health experts. And they're saying that we have to continue to adhere to the CDC guidelines. So, this means that we should continue to wear masks, practice physical distancing, and make sure that we're washing our hands. But we have to understand that this summer will look different. So we have to take the responsibility to make sure that we keep ourselves and our community safe. As many of you are aware, the National Guard did put a pause on the testing site on the north side of at Midtown. But I want to stress that just because they have put a pause there, doesn't mean that testing isn't currently happening on the north side of the city or in Milwaukee County. So if you are feeling symptomatic, if not feeling well, and you want to get tested, please call 211 and they can find you a location near you so you can get an appointment scheduled. So it's critically important to utilize that 211. But as we think about this, it's impossible for us to ignore the facts about our economy. And so when we think about Milwaukee County, we've seen an increase in services significantly as a consequence of the COVID-19 crisis. And it's directly impacted many people of color because 78% of the overall cases impact people of color. And here in Milwaukee County, we've definitely seen an impact because more than half of the deaths of COVID-19 related are here in Milwaukee County. So we have to continue to talk about the need of Federal CARES Act relief funds to support the essential services that we offer. And later on during the briefing, Dan Bones from Milwaukee County Transit System is going to touch on one of the prime examples we have, which is our county bus system, which is definitely an essential service. And, several weeks ago, we made the decision to suspend fares in order to limit interaction between riders and drivers. And so, we've taken additional steps and we're going to continue to make steps to ensure that there's safety on the buses, not only for our riders, but also our drivers. And so he's going to share a few of those changes that we'll begin to see to help address some of the financial shortcomings that we see happening. Because the cost is providing critical services related to this pandemic are staggering and they continue to intensify because of the economic slowdown, which is causing a significant strain on our already strapped county budget. So we're looking at, again, a total of a $450 million impact, and that's through new costs, but also a loss of revenue. And, it's going to have a dramatic impact on our ability to respond to the COVID-19 crisis. And so I want to thank the governor for his important public health investments that he's currently made, which undoubtedly definitely benefits Milwaukee County and all of our residents. But our need is still significant, and we could definitely use some more funds. And I think it's critical that we act quickly. And so I just want to make sure that we continue not only our continued partnership with the state to find adequate funding, but also our federal congressional members to make sure that we continue to lean on the current presidential administration to make sure that we're bringing as many federal dollars, direct and flexible, to local governments like Milwaukee County. So with that, I'll pass it over to Mayor Tom Barrett.
Thank you very much, Mr. County Executive, and thank you all for joining us today. A couple issues that I want to touch on. One is that there's a lot of interest, obviously, with the suburbs reopening a lot of their businesses as to when the city of Milwaukee is going to move to the next on a daily basis to literally look at the criteria, the gated criteria. Dr. Weston will talk a little bit about the criteria and perhaps some changes that we have seen. Commissioner Kowal can talk about the issues that we're looking at. And they really come down to a couple different places where we know that there's more work that has to be done. One of those issues is testing, and the county executive alluded to the testing that we have going on. I know the Lieutenant Governor is here to talk about that, as well as Dr. Izzard. Right now, we want to stress again that if you are someone who is symptomatic in particular, it is important for you to call 211 or to call your physician. And on the north side of the city of Milwaukee, and Dr. Izzard is here, of course, representing Milwaukee Health Services. They're doing testing for people who are symptomatic. Outreach Community Health Centers on Capitol Drive, Progressive Community Health Center over on Lisbon. Ascension has actually 3 different sites at the St. Joe's campus on 11th and North Avenue, as well as the old St. Michael's site on 24th in Villard. Freighter has a site actually in Menomonee Falls. So if you're on the far northwest side, that would be a site that would be available to you. On the south side, there is still 16th Street Health Clinic. And for people who are asymptomatic throughout the entire region, there's a site at UMOS. And there's been a lot of debate over asymptomatic versus symptomatic. Part of our thinking here is we want people to rely on our community health centers. We want them to use our hospital systems, but we are actively working with the National Guard, who has been incredibly helpful throughout all this, to have another site if the decision is made to continue to test asymptomatic. And that's one of the things that we'll be discussing this week, whether that is the right decision to make. But again, if you are showing symptoms, please call 211, call or visit one of these places and make an appointment for one of the locations that I've listed. That's very, very important for us to do. There's been some inquiries about religious services, and I've had some good conversations over the last 72 hours with some faith leaders and explained to them that this is really a health concern we're dealing with. This is not politics. No one is trying to start a fight. No one's trying to do anything other than making sure we're taking every precaution necessary to make sure that we don't have outbursts or outbreaks that would occur in faith settings. So a lot of work continues to be done. Again, we're thankful for the incredible partnership with the county, with the state, with the community health centers, and with the hospital systems as well. A lot of people have been working, but as the county executive said, it really comes down most vividly to individual behavior. And I think many of us saw the pictures from the Ozarks where the people were in the pools. I saw some pictures from Bradford Beach where I thought some people were getting a little too close to each other there. Please don't ruin it for other people. That's my request. Please don't ruin it for other people by not following. This is not necessarily about you. It's about everyone. It's about our community. And that's why the social distancing, that's why the masks, that's why the hand washing is so important in everything that we're trying to do right now. So again, a lot of work is going on, and we appreciate the incredible outpouring of support we've had to try to make sure we get life back to normal as quickly as possible. Thank you, Catherine. Back to you.
Thank you, Mayor Barrett. And I'll do the honors of introducing Lieutenant Governor Barnes. Thank you so much for joining us today. Oh, you're on mute. Dilla.
Yeah.
There we go.
Do not be confused or under the impression that people of my generation had technology figured out. Thanks so much, Catherine. Thank you, Mayor Barrett. Thanks, County Executive Crowley. Everybody else who's on the call too, who's gonna speak a little bit later. But I'm Mandela Barnes, Lieutenant Governor. Excited to join you all. Obviously, not enjoyable circumstances, but as we come out of Memorial Day weekend, and as more and more businesses reopen their doors, it is more important that we exercise caution. And Mayor Barrett, you touched on it, and this isn't about us. This is about keeping ourselves safe and exercising caution for the people around us so that we don't see another outbreak. But we are still, as you know, seeing the increase in the number of positive cases in Milwaukee. And a lot of that is due to the increased testing. But the rate of positive cases is not where it should be. I still personally feel, and many others do as well in the medical community and the scientific community, that we are in a premature reopening. But on Saturday, for the 5th day in a row, more than 20% of the COVID-19 tests came back positive. Our goal was to have 10% or fewer positive tests. More people are going back to work. And many people, especially in our Black and Brown community, who've been working this entire time, these people are at an increased risk of infection every day. And so we need everybody, no matter who you are or what you do, to continue the physical distancing. Washing your hands, as was mentioned before, these are things that shouldn't need to be repeated, but we're going to keep repeating them because these things haven't always been put into action as they should be. But washing your hands more frequently, staying home as much as possible, and wearing masks whenever you need to leave the house. And we understand that people do have to go to work. But for those who are patronizing our local businesses and great restaurants, please, it is imperative that you take those steps to protect yourselves, to protect the fellow customers and the workers, especially who are providing these services, who are putting themselves at risk. And everybody, in a public facing position should still go get a test. If you're a high risk or you've been exposed to someone who's tested positive, get a test. It was mentioned earlier on the south side that UMOS is still testing people every day. And on the north side, anyone can get tested at Aurora, Ascension, or any of the community health centers. And if this was already mentioned, but I'll repeat it, call 211 to find a testing site near you to make an appointment. But it's important for us all to, be cautious, but also encourage other people to be cautious. As the weather is changing, it's very difficult for people to stay in the house and not resist the temptation to go out into large gatherings, because that's what we do. That's what we do in Milwaukee. This is the time of year where we would normally do that after a very long winter. And I know it can feel like we've missed out, but I guarantee you that we will miss out on so much more if we see another spike in infections. And if you yourself is to get infected and you end up infecting others, you are going to miss out on so much more. So thank you again for having me, and I'm going to stick around for, I know I have a little bit more time to stick around.
All right. Thank you very much for joining us, Lieutenant Governor Barnes. And now I get to hand it off to Dr. Ben Weston.
Thank you. Good afternoon. Starting as always with our numbers, we have 6,535 cases of COVID-19 in Milwaukee County and 257 individuals who have died. As we've discussed, there's 5 key indicators that we track on our COVID-19 county dashboard to better understand the overall health and status of our community with relation to COVID-19. And while 3 of those have remained unchanged, 2 of these indicators, specifically cases, which represents the trend on percent positive cases, as the Lieutenant Governor mentioned, and then care, which represents the hospital resources dedicated to COVID-19 patients. So cases and care both moved in the wrong direction today, looking over the weekend, looking over the last 4 days. We update this currently twice weekly. So for cases, based on the data that's been entered at this point in the statewide database, and I will preface that we're waiting on a portion of the data from those National Guard testing sites. But based on the data we have, we've changed the indicator from yellow over to red, as we've seen a statistically significant positive trend, an increase in the amount of percent positive cases. And then shifting to the care metric, we moved from green backwards to yellow, as there currently are more COVID-19 patients hospitalized than we've seen at any point, any day over the last month. So overall, our indicators in the 5 categories are 3 yellows and 2 red categories. So what does this all mean? Our indicators, as I said, are meant to summarize how we as a community are doing. And clearly, we're at a critical and fragile period. While it's too soon to say definitively that these changes are necessarily due to pulling back of the stay-at-home orders, we can certainly say that we must be especially careful in our dialing back of physical distancing. Whether through orders in place, messaging being sent out, or individuals making informed decisions, the opening of our homes, our businesses, and our economy must be done with care. So by these metrics, all green marks would be excellent. I think it's pretty clear we are not, as a community, in the excellent category. We're making headway in this battle against the pandemic, but there's more work to be done. Work for the government, work for business owners, work for individuals to ensure personal and public safety. Thank you and stay safe, and I will hand it off to Commissioner Kowalik.
Hi, happy Tuesday, everyone. I hope everyone had a relaxing holiday weekend. Again, noting some of the points that our county executive, our mayor, our lieutenant governor, and Dr. Weston have made related to being mindful in how we're moving forward, or pacing ourselves, if you will. As quickly as we can move into getting back to some type of normal, we can make things worse. It's just like healing up from any procedure, that we have to do it in the right way so that we're not causing more setbacks down the road. So the City of Milwaukee data is normally updated at 2 p.m. every day. Since this format for these meetings will change to 2 p.m., we'll have to make a little adjustment. So I have data from yesterday. So the number of positive cases for the City of Milwaukee is 5,047. and a number of fatalities is 173. So as you can see too, as far as the death rate has been kind of holding a little bit, which is good, which is what we want, but the concern about the hospitalization and having to admit people for COVID symptoms is very concerning. So we'll continue to monitor that. The hospitalization rate for the city of Milwaukee is 15%. And as you know, earlier on, that rate was very high, especially among some of our communities of color, because some of the testing earlier on only focused on people or prioritized people that were in the hospital. So of course you're going to see a higher rate. So we're seeing that rate go down, which is great. However, the number of cases that continue to increase, and as we have more testing, we'll have to continue to monitor that very closely. As we noted on Friday, that we're reevaluating where we're at as far as moving from phase 2 in the city of Milwaukee to phase 3 on Friday. So stay tuned for that update. I know Dr. Weston talked about the county level data and indicators of 2 of them falling back, but just know that the city of Milwaukee, we're looking at some of the 2,400 tests per day in the city of Milwaukee as what we're measuring. So that information definitely is a part of the whole, a part of that 4,000 that the county is seeking, but we're really looking at our contribution to that total number. So please be aware of that. We also know that we need to make sure the data that's going into feeding the indicators is tight and streamlined. We want to paint a good picture of what's happening. So our ability to have updated information is very critical and important. This is another reason why we're assessing once a week, because it gives us time to be able to see how things are going. I also want to note about some of the comments about the North Side testing location at Midtown. And I know over the weekend, we were fielding a number of concerns about the optics of removing that site even temporarily and still keeping the UMO site. So there's a group of people that include people from the state, healthcare partners, the county, and then have pretty much informed how things were going, knowing that there were a number of challenges with being able to enter data and get back that information or give that information back to the jurisdictions where those people reside, so they'll know if they're positive or negative, right? So there was a number of issues that needed to be ironed out before continuing that. So the goal initially was to put both of those sites on pause so that both of them could be recalibrated. But there were concerns about the south side or the UMO site as we were looking at other options for testing in the area, knowing that on the north side, the Midtown site would be taken over by Aurora, which they did. So thank you, Aurora Advocate, for stepping up. But the difference in that is that it's not just drive up, no appointment, that there is an appointment feature that's required. So that contact information is listed so they can have adequate staffing. And then also knowing too that many of the healthcare providers are requiring at least one symptom. We know that symptom list has gotten much, much longer and broader over time. I mean, I technically have one of the symptoms now. I have body aches. I always have body aches, but that's what happens when you have an autoimmune condition. So knowing that there's these variety of symptoms that you have to check at least one, that's what they're looking for right now. So I just wanted to clarify that. And then the need to move from temporary sites to permanent sites, knowing that the National Guard's not going to be with us forever. We're very grateful for their support for these community testing initiatives, as well as employer-based testing initiatives. We've had a number of those where they have provided some support or have been willing to provide support to providing testing for all employees when there's an outbreak at a site. So they'll test. I just wanted to acknowledge that, some of the backstory on what's happening there. So technically, the Midtown site now is being taken over by Aurora, and the health department is working with these other partners as a part of a group, this testing collaborative group, to dedicate another community testing site where there's no appointment required, where there's no symptoms required, that you could just drive up. But I just want to stress again that that's not going to be long-term because there's no capacity for that. So the availability of the National Guard, my understanding is, will be until near the end of June. So we'll provide more information on that. But in the meantime, look for other opportunities to stand up testing opportunities throughout the community to make sure that there's broad access and no limitations or barriers to people knowing their status if they're COVID-19 positive. I also want to stress too, with being tested, is that that's a point in time. So you can test today and be negative, and test tomorrow and be positive. So this is very important for everyone to understand that once you're tested, it doesn't mean you're good. You may be good for the moment, but you know, depending on the type of occupation you have, if you're an essential employee, that you may need more frequent testing. So again, when we're looking at how we're measuring, how we're going to open things back up, 2,400 tests a day, those can be multiple because some people, depending on their industry, will need to be tested multiple times. And then the last thing I want to talk about is related to a campaign. We know that there needs to be additional outreach, continue to be hit hardest by COVID-19 in the city of Milwaukee. There's a campaign coming out called Stronger Together Collaborative, the You Matter campaign, and there'll be more details about what this means on the 28th. There's going to be a virtual roundtable, which will be the launch for this initiative. And I know Dr. Izzard, who's next, he's been a part of that too. May want to say a few words about it. But again, it's looking at how are we doing messaging. So you see these banners for people that have the Stay Home, Save Lives, Milwaukee, or whatever jurisdiction they're part of in the county. But we realized that that messaging didn't necessarily resonate for some of our communities of color. So there needed to be something that spoke to being mattered, valued, and a sense of hope. So this campaign, which is really just not a campaign, it's a movement, will address those concerns, and it of course includes culturally relevant and appropriate images and other types of activities to really help our communities understand the risk associated with COVID-19, and also to, again, move from just PSAs, which is something we did early on because we were, you know, in response mode, and we still are. But the need to move just from something very static to something that's more active in the coming weeks. So we're grateful for that opportunity. And then the health department's involvement with the county and the Stop COVID-19 outreach campaign, which addresses communities of color as well. That's something that's in the works too, that started at the beginning of April, and that there is additional supports and messaging coming out. When we look at demand for testing, we know that Midtown site went down 60% in the second week. We still need to hit the road hard on outreach. We still need to make sure people understand that this is still something that exists in our community, where you have people that are just poo-pooing this and acting like it's, you know, the boogeyman, that the virus doesn't care if you believe in it or not, that COVID-19 will still impact communities across this country. We will continue to see rises in cases as people go back to congregating and not wearing masks and not taking additional precautions as far as prevention is concerned. So we want to make sure the communities in Milwaukee that are most vulnerable have the resources and the information that they need to protect themselves. Thank you.
Thank you. And as you just noted, we'll next hear from Dr. Tito Izzard, President and CEO of the Milwaukee Health Services.
Hi, thank you. Thank you to the mayor and to our new county executive, Crowley, as well as the rest of the guests here. Just want to briefly speak a little bit regarding services that are being provided through the community health centers, also called the Federally Qualified Health Centers. There's one near you within your neighborhood, north side and south side throughout almost all of Milwaukee and Milwaukee County area. At those locations, anyone who has symptoms. So let's review some of the symptoms again. And it is, as Commissioner Kwok was mentioning, pretty broad. So the typical things that initially we heard about would be cough, having any type of fever, having any respiratory challenges or problems. Some people may have experienced nausea or vomiting. Symptoms that has come on more later as we've gathered more information nationally, that people may have a change in taste or change in the ability to smell. And so if you develop any of those symptoms, please contact your healthcare provider so that we can review it with you. Of course, not all symptoms that we just mentioned there means that you have COVID-19. Because those symptoms are so similar to many, many other things, it's important to have a healthcare provider to be able to talk to and review that with you. During that process, we'll work with you to determine whether a test is appropriate. And if so, then you would be considered a diagnostic test, meaning that you may have a symptom, that warrants getting the test. And those tests can be provided to you typically within either the same day or within 24 hours of your need and in a location that's convenient for you. Now, because of that, we want to make sure everyone if you have a primary care provider, you will speak with your primary care provider first. If you are uninsured and you have concern regarding the cost, we will work with you at the Federally Qualified Health Centers. There is no out-of-pocket cost for anyone related to the COVID-19 diagnostic testing, as well as any type of follow-up that you may need related to this condition. And if you are someone who you may have insurance, but you just don't have a primary care provider, or someone who you can go to for your regular healthcare needs, we welcome you to the community health centers where we can try to help address your immediate issues regarding COVID-19, but also be able to, if you would like, establish a longer relationship so that you can address your other issues such as hypertension, diabetes, or any other health concerns that you may have. So we look at it as a longer term relationship, not just an immediate need. Now, with that being said, it is important that everyone understands that on the north side of town, there will not be any community screening going on, okay? No community screening for COVID-19, meaning if you do not have any symptoms and you just wanted to know what was going on or what you may have, that is not available on the north side of town. If you have symptoms, yes, you can get that tested. Now, to me, that is a concern and I don't know how long we'll be able to have a discrepancy by having a government-induced structural disparity regarding health access. So on the south side, everyone under UMOS, as mentioned, will be available. Anyone in the whole Milwaukee County can go and receive the screening, but that will not be available on the north side. And we know that there are going to be families on the north side that won't be able to make it to the south side for screening. So at some point, I think with further conversation, there definitely will have to be how are we planning to provide an equitable process of community screening through our community and not just on one location, even if that means looking at one central location that can provide that service to all.